lovely Jade. You're on the Canine Arthritis Management streaming platform, but we've had IT issues, so it's only going to come out on the StreetVet page. So any CAM followers who have come over to the StreetVet page, hello, you'll recognise me, and any StreetVet people that are on your page will recognise you.
Okay.
Good. This is quite stressful, isn't it?
A little bit stressful. Just
You're
a little
fine.
bit. Not a lot.
So anybody that is watching, you're more than welcome to put questions. We will answer them the best that we can. We're going to be here for around about 30 minutes, just having a bit of a chat, because me and Jade met each other about a week ago.
Yep.
We are both pretty passionate about what we do. Got quite a lot in common, which is checking your phone at all times, day and night, spending most of life emailing or on Facebook, now having the concentration span of a gnat bite. Social media so much. So we got in touch and we were chatting, and we thought, actually, there's a lot of common stuff that we're dealing with. One of the big problems that you face with dogs on the street is arthritis, and how to advise your people to manage it best. And something that's very close to my heart is people that may be on low income or have reasons that they can't pursue expensive interventions. That's my little passion. So we thought, actually, we'll do a Facebook Live, which is supposed to stream to both pages. Didn't work. And have a chat, because we're challenged by the same things all the time, aren't we?
Yeah, definitely.
So what the kind of thing, talk me through something that you regularly see.
So a majority of the dogs that we're seeing are not young. So we are dealing with an older population. A lot of them are, larger breeds, so Staffy Cross. And what we're seeing is, yeah, definitely, no doubt about it. These dogs are suffering from arthritis, or we've had quite a lot of cruciate injuries that we've been managing and dealing with sort of post-surgery, and then what that's going to involve. So yeah, we have been we're limited in what we're able to do, obviously, for obvious reasons, be it because we are obviously dealing with people without a fixed abode, who don't have comfy bedding and padded bedding and ability to drive the dogs to go for a little walk in the grass. And these dogs are on the street, they're constantly on pavement, and that in itself it is an issue if you've got joint issues and if you're in pain.
Yeah, so because we want to kind of crack on to content really quickly, and not just kind of go, yes, we've got a problem, Houston, let's deal with it, let's talk about it. So I thought we would just kind of bounce back and forth ideas. Now, the first thing that I wanted to talk about, which I say regularly to the people that contact CAM, is this isn't your fault. There's a massive amount of guilt, there's a massive amount of sadness, there's a feeling that they've let their dog down, they've done something wrong. And what people need to know is that often this isn't your fault. Quite a lot of variations means that they're more prone to these joint problems. So you might have actually got a breed that has developed a joint that's not quite perfect. And because it's not a perfect fit with each other, the bones on bones, then you get quicker, you get earlier wear and tear, and that is what causes arthritis and what you see. So first take home message from me, please don't beat yourself up. Now let's move forward and let's do something about it. Do you want to add anything to that?
Yeah, no, I think that's absolutely right. I think people do definitely, feel guilty, feel like, did I not feed my dog the right thing, or have I done something to aggravate them by exercising them too young and things like that. And I'm sure you're going to cover that aspect of it as well.
Yeah, so I think you led really nicely onto probably the biggest topic that's not dealt with very effectively in veterinary medicine, whether you're registered at a vet or not, is weight control. So we had a little chat just before doing this live about things that we both really agreed with that needed to be addressed. And weight is massive. definitely let's not get our knickers in a twist about exactly what you're feeding. It is the actual weight at the end of the day that your dog is carrying, which is really important. So it's not just the mechanical weight carriage. So it's not just the hefty bags of fat that they're carrying and what it does to their joints. That fat that they're carrying is like fuel to that arthritic fire in those joints. So something that is completely low cost, is available to everybody, is to learn what is the appropriate weight for the dog to get them as trim as possible so they don't carry that extra weight and they don't have that inflammatory impact. So what kind of things are people feeding with your clients?
I mean, a lot of it that we're trying very hard to look at that. So we actually, because obviously it's hard, you can't weigh these dogs on the street. But we do have, you know, like the flight things, so you can do a bit of a weight on some of the smaller dogs. But we've got measuring tapes, so we can, you know, like do that kind of measurement to explain it to people how they're getting on with the weight. But we have now switched over. We get our food provided by various different companies, so that has helped to try and have a bit of stability and continuity in diet. But beforehand, they would be feeding whatever they could. So, you know, if they were sitting outside a McDonald's, their dogs would be getting McDonald's, you know. So we do see animals that have not been fed on an ideal diet. And that, I guess, the main thing StreetVet can do is help them to understand how much they should be feeding, doing a bit of measuring when we see them every week, but also explaining, you know, getting a consistency in what they're being fed.
Yeah, and it's really similar with the people that we see online. So I definitely encourage people to learn something called body condition scoring. And it sounds more intimidating than it is. It really is simple. The simplest way I can explain it is your dog's front legs go down to the elbow, go 2 inches back from the point of the elbow and feel over the rib cage. And it should feel like your knuckles. Okay. So if you're pressing lightly and there's sponge, like a Victoria sponge cake in between, that's fat. So that's one of the most simple tests that you can do. Another really good test is to just pretend the dog isn't yours and stand back and look. And we get so emotionally involved with our pets that quite often we don't take a kind of objective viewpoint. So another thing that you can do is ask somebody else to hold your dog, take 5 steps back and look at them from the side. Do they have a chest that goes up into an abdomen? So do they go chest into belly? And then walk over to them and look from above. Do they have a rib cage that comes into a waistline? And you can, with that, be pretty accurate at getting them to a good weight. So all the tools that you find in vets, you know, we can bypass that for these kind of situations. So that's my take. What next? We've done weights, which is a really big one. We could go into food a little bit further, but we are very aware that people with limited resources aren't going to be able to afford amazing supplements and amazing foods and all of this. Is that the kind of feeling that you have with the guys that you're dealing with? Because I certainly know there's a big pool of people that follow Cam that are doing so on quite a tight budget.
Yeah, I mean, we get a lot of support from pharmaceutical companies, but I'm much more inclined to be looking for that support in sort of a non-steroidal anti-inflammatory world rather than a supplement world, because I feel like in order to for it to potentially work, we have to be using it very continuously, and that might be an issue in meeting up with our owners. But also I would rather be putting our resources into things that I know for sure are definitely, you know, are definitely working.
So that's a really brave statement. I'm really glad I took the hit for that one, because we did talk about this and we both find it's a really difficult area because, as said, I'm really conscious of a huge population of people that might live in a home, but they're still on very limited resources. And it doesn't mean that they don't love their dog. They adore their dog and they're trying to do it to the best they can. And they are very much trained to believe that unless they're putting expensive supplements in, they're not a good owner. And I don't believe that at all. I do feel that there are many, many things that you can do that are just as powerful. And my phrase that I love is hashtag more rugs, less drugs, because I really believe the environment has a massive impact. So thanks for taking the hit on that one. I totally agree with you. According to the literature, if you did have the means to use a food supplement, the most reliable one that people globally agree on is fish oils. So that, if just for your information, there is more evidence about the other ones. So there's the type 2 collagens, the avocado, soybean, unsaponifiables, the CBDs and everything. But there is less agreement on that. So for now, don't worry about it. There's more stuff that we can do.
It's basically down to how you prioritize spending your money. I mean, obviously, if you're in a situation where you do have the funds, then, it's certainly not going to do any harm. But if we're looking at what sort of got actual evidence out there, other than what you've just said about those particular supplements, that would be the situation.
Yeah, because what I think breaks my heart is when people come in and they have got this kind of, I'm doing everything I can and I just really can't afford those x-rays and I can't afford the blood sample to check that the kidneys are okay, or I can't afford the urine sample, and I'm really going to be stretched to be able to provide that non-steroidal. And you can see that they've been to maybe Holland and Barrett and they've got 6 different supplements, which we don't even know if what is in there in any kind of active form. So park the supplements. We're not poo-pooing it in total. We're talking about really restricted financial cases where we've got to do things that we know are going to make a big difference. So let's talk about non-steroidals, because I use them a lot. I'm really confident in them. I know that there is a potential for side effects, but when I look at the frequency of side effects compared to the use, I really am not in fear of them. I do certainly talk to people that there is a potential, but I say, in my 18 years as a vet, I have dispensed more non-steroidals than any other medication. It's probably the biggest thing that I've ever done, is dispense non-steroidals. How do you feel about that?
Yeah, no, I mean, definitely in agreement. I guess for my time in practice, there's obviously so many more, entering the market, and there's lots of different, variations. But from a street vet point of view, we are using what we feel is easiest for the owner. That's what it's all about. It's about compliance, and it's about ease, and it's about palatability. And so we are largely, using one non-steroidal, and we're also using paracetamol. They're the 2 main things that we're using.
Yeah. So the reason that I like non-steroidals is, as I say, a lot of evidence behind them, but we also know that they're going to work quite quickly. And if you're dealing with pain, I know if I'm in pain, I want it dealt with quite quickly. But I also want to make sure that it isn't wound up and made worse. And if we leave pain unattended, we know it gets worse. Sorry, someone's just hoovering outside the door. Okay. So one of the reasons that I go for a non-steroidal is it also confirms my diagnosis, because no dog comes up to me and goes, by the way, I'm in pain, this is how I feel, and this is how bad it feels. They will say, they'll have a posture change, they'll have a behavior change, and it could be something else, potentially. So I want to put them on a drug that I know is going to work on pain, so that I should see them get better. So therefore, I know that my diagnosis is in the right direction. Put a dog that I believed was in pain on a non-steroidal and it wasn't getting better, then my brain says there's something else going on, which leads me really nicely into a question we've just had. Can you talk a little bit about hyperthyroidism and an overweight dog who is also arthritic? You probably talk about hypo, which means an underactive thyroid. He asks, what should the course of action be? Medication, frequency, exercise, diet, etc. We can touch on it, but I don't think we can go into a huge amount of detail. Complication for me first is to make sure that it actually has confirmed hypothyroidism. Would you be the same?
Yeah, I was just looking at the question. So, I actually have a dog with an underactive thyroid myself, and it absolutely is getting the dose right and making sure that you're checking, because sometimes the thyroxine requirements change. So it's making sure the diagnosis is right and making sure that the dose you're using is correct as well.
Yeah. And then if you get the right dose of thyroxine, then you should have ability to shift that weight. You should have improved attitude to life, enthusiasm for life, motivation, so more willingness to exercise, etc. And we know that arthritis needs exercise, it needs mobility, it needs movement. And the way that my brain works in a really simple way is if I can control pain and I can improve mood and I can make the environment safe, then I'm going to get improved mobility. So therefore, I'm going to have moving joints, which are going to lubricate, that are going to stretch, and they're going to be better, and they're going to be less painful. So it's a lovely positive cycle for me. There is loads more we could talk about, foods and other medications, but we're not going to go there. We're going to move on. So we talked about nonsteroidals, we talked about foods. Let's go into the stuff that I think is so neglected, and that is lifestyle. So for me, the first thing to do is a phrase that Andy Gardner recently gave me, which is minimize aggravating factors. And that means trips, slips, falls, stumbles, all of those sorts of things that will exacerbate joint disease. So for me, that would be if you had somebody that, as I say, was living on the street and they didn't really understand their dog's disease, but they just thought the best way to entertain it was kicking a tennis ball against the wall back and forth. And the dog would be like, oh my God, this is an amazing game. And they'd do it and they do it and they do it and they do it and they do it. And those joints are going, ow, 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 ow. I'm going to kill the person with the Hoover in a minute. When you just kind of go, really? And it stops again. But so for me, that would make a lot of sense to talk to them about minimizing aggravating factors. Do you kind of go into that in quite a lot of detail?
So I guess it can sometimes take quite a lot of trust with our owners to get to the point that it's not that you're giving criticism, because that's not what it is, but you're giving recommendations, and that in itself, they're automatically a bit worried that you're saying they've been doing something wrong. So I think there's quite a lot of guilt, but like what we talked about at the beginning. But they are incredibly open to help with factors to do with like the medications and things. But I think when you sort of start talking about sometimes how they are looking after the dog, even though it's they're doing their very best, I think that they can sometimes be a bit more worried about that. So for instance, we've had dogs where we've managed to convince the owners that getting a buggy would be helpful, just because even though you might say you shouldn't do that much walking with your dog, they're not in an option of a situation, because if the soup kitchen is there and where they're based is over here and that's their safe space, that dog's got to do that kind of exercise. And an ideal world would be that they were on soft ground and all these things. So that's why we've had we've moved forward with trying to get buggies for these dogs, and that in itself is I think has revolutionized quite a lot of the owners' lives, because they don't feel guilty. They're like, okay, in the buggy, off we go. And they feel
do you
like
think you've dealt with a taboo? Like we're quite proud that Holly's Army people that have thought about getting a buggy, but they've always been worried about what other people might think of them, have come into this online community that goes, no, go for it. My life has changed since I got a buggy. I'm now going back and walking the dogs as a pack, because I know when my less able is tired, I can give them a rest. The same with you guys? Do you feel that it's become an okay thing to do?
I think some of our owners struggled, but I think like when they see the really, because the public have been amazing, the really positive response to the public when we put an ask out to get their particular dog a buggy, and then the sort of we put the post up, and then everyone's just like, oh, I helped to buy that buggy. I think that whole thing makes the owner like really proud, actually.
I totally agree.
And so we're trying to help with that, certainly. But yeah, the toy thing, I think maybe the balls and the throwing and stuff, because I don't think they do as much of that, because they're maybe not got as much access to going to the park and stuff, because they're usually quite central London. But yeah, I mean, it's all things they are absolutely, our clients are receptive to, if you can just ensure them that it's not that you're criticizing them, we're just sort of discussing how we can improve things.
I think that's the same across both platforms, though. We definitely are learning how to converse with owners better. You know, I've been a vet for 18 years with the table in front of you and that kind of white coat effect. But now that I'm listening to people online and being on the same level as them, I feel that I'm understanding what they need from us a bit better. And as you say, approaching them as this isn't a criticism, this is just let's take a new direction on this. Just spending a little bit of time talking about inappropriate activities, I do think that bringing attention to their potential to do harm is a really good idea on both platforms.
Yeah.
I have actually received hate mail about this. I'm almost proud because I am strongly in the belief that we are being inappropriate with our ball throwing activities, our ball chuckers, our frisbee. I think, you know, all of these things in moderation. It's just the fact that we are being encouraged to go crazy with it. Please be aware of the damage that can be done. And if you are damaging joints, damaged joints become arthritic joints. And you only need to damage the joint capsule by stretching or twisting or pulling or straining. And you are setting up inflammation in that joint, and that inflammation can certainly turn into arthritis. So be really aware about these activities that you do, no matter it's young or old. Other things that I don't know if it's so applicable, but it might be, is that we try and give a lot of lifestyle advice in the home. And when you live in a house, you don't tend to notice the obstacles, especially something that's not going to apply to you guys. The world is trending for slippery floors. We like easy clean floors. We like that sterile, you know, I can just mop the floor, I can just sweep the floor. And that because of that, owners walk in their shoes. So we have grip. We are really unaware of how dangerous these floors are. We would never walk around in our socks because it's a hazard. You know, your 3-year-old daughter coming flying down the stairs in her fleece socks, you'd just be like, no, that's dangerous. But I don't think we're as aware at how dangerous these environments can be to our pets. Do you have anything similar with you guys, or they're not exposed to that sort of thing, are they?
Not really. I mean, obviously, some of our owners are in hostels, and the hostels take. I mean, it's more like wooden flooring, I would say.
Yeah.
So you know, if we do get owners moving into hostels, like we have been involved in, you know, getting them like, you know, bedding for the dog. You know, especially if they're an elderly patient. You know, we have got a couple of ramps for dogs as well, like to help with that. But I would say it's sadly they are mostly walking constantly on pavement, which is not ideal.
No, that's harsh, isn't it? So looking for something that cross links back again, that we cover the same pavement with warmth. So I definitely know that I've seen a lot more interest in these non-pharmaceutical interventions, such as just putting a coat on your dog, just making sure it's warm, just making sure its muscles and its bones and its joints are kept warm, because we all know what it's like. If I get cold, your shoulders come up, your back tenses, everything just starts to get very uncomfortable. Now, if you've got a back-related problem secondary to joint disease, or if you've got a back-related problem on its own, or a neck-related problem, or a shoulder joint or a hip joint, keeping them warm can offer quite a lot of relief. Do you guys help them out with dog coats and stuff?
Yeah, absolutely. So we've got an Amazon wish list for like all of our locations, and yeah, about this time of year we're giving out lots and lots of coats.
Wow!
Yeah.
Oh my gosh, that's such a good idea.
Yeah, coats, and yeah, it's in the summer it's cooling mats, and then in the winter it's yeah, it's back to the coats and all that kind of stuff. So yeah, the public are amazing.
That is really amazing. That is really amazing. Okay, so talking further a bit about lifestyle things. So for us, we have to deal a lot with people that do have cars, which you guys obviously don't have to deal with. But you did mention ramps, and I think we can all take home a message that inappropriate descents inappropriate impact forces we know are a really big trigger for flares. So just all of you guys that are totally new to the disease arthritis. Arthritis is a degenerative condition within the joints, and it is a progressive condition, and we can't cure it, sadly. There is no cure. We can only but influence it. We try to palliate it. We try and minimize the clinical signs that come with it. We try to slow it, but certainly inappropriate lifestyles such as jumps and falls and high impacts and torsions will really wind it up. So a classic thing that I see as a vet will be an owner generally coming in on a Monday or Tuesday, and they've been out for a massive walk at the weekend, and the dog's jumped in and out the back of the car, or been in and out the river, or they've been for an excessively long walk, and that dog hurts because it's totally overdone what joints are capable of doing. So with our advice to owners is understand what type of exercise, how much exercise, and inappropriate activity. So one of our team members, Danny, she said something that, whether it's true or not, but I think it's quite potent, is a dog only has a certain number of jumps in it. Why waste them? And I thought, do you know what? That's quite cool to get the message across. Does your dog need to be jumping that 4-foot drop from the back of your, discovery, and boom on those elbows and through those shoulders and into that neck, twice a day? Could we minimize that? Do you have that sort of thing happen with you guys? Are there situations where you're having to instruct people to just kind of rein it in, change a habit, a routine?
Yeah, I mean, probably not in terms of obviously getting in and out of vehicles or things like that. But I think just what you're saying about, that ball throwing and the twisting, that's something you can get across to people, that same repetitive impact is not a good idea. But yeah, probably, I mean, to be honest, the ramp was bought to help a particular owner get his dog on his boat. Because so she's been just to try and minimize that impact for her, getting in and out of the boat.
Yeah, that's good. Okay, so I'm just now trying to think of other things. Now we're going to dabble. We've done weight, we've done food. It's not your fault. This is a very common disease. They believe that 1.2 million dogs in the UK have arthritis. So 80% of dogs over the age of 8, 20% of dogs in total, and that is believed a potential underestimate. So this is a big problem. It's not your fault. You haven't done it. So we talked about weight and we talked about food. We've talked about supplements. We've talked about drugs, nonsteroidals being the first, but there are many, many behind that. So when you go to the vet, don't think that it stops at an anti-inflammatory. There are other options. You mentioned one of them being paracetamol. We talked about some lifestyle changes. So we've talked about minimizing impact forces through exercise and habits around, your daily routine. We talked about keeping them warm. Something that you already have incorporated into managing your dogs is some of the complementary therapies, isn't it?
Yeah.
So what kind of things do you think, what are you guys doing on the street in and around the UK?
So we are very, very fortunate that we have got so many skilled people on our team. So we've got people who do hydrotherapy, and obviously that's not on the street, so we arrange for them to go somewhere. I know we've got our swimming pool we take round, and we have people who do acupuncture. We have people who do physio, who do myotherapy. Yeah, we're really fortunate.
You're really lucky.
So we do kind of an array. It differs obviously in our different cities, but certainly where we can offer it, we will add that in.
That's cool. So we at CAM, so the CAM team, we try and have a multidisciplinary team. So we have laser therapists, hydrotherapists, massage therapists, physiotherapists, vets, specialists, etc. And it's great because we all share our knowledge and we challenge each other. All of us are massively involved in managing chronic pain because we've seen the benefit of our intervention. So I'm really into rehab, so physio, massage, all of that sort of stuff. And I've seen the amazing ability these little jobbies can do, and they're free. And that's what I think really excites me, is that many of the interventions that I've talked about, that I'm really passionate about, is because they're free. That means anybody can use them. And for me, that means that every dog, no matter who owns them, has the ability to have some of that pain taken away. So massage is really quite powerful, because people forget that it's not just about the joints. There's a lot of stuff going on around it. And if that joint's not working very well, then that dog will ask another part of its body to work harder. So a classic example would be a dog that's got arthritis in both of its knees. It's not going to have so much propulsive capabilities. The front end of the dog will start to have to do more. It'll have to pull itself forward. All of this is subtle. You won't see it. You know, dogs are amazing at coping. It'll be very subtle changes. But the muscles and the soft tissue, the ligaments, the tendons, the fascia, they know about it. What you'll find is a lot of these dogs, the pain isn't localized to those joints anymore. They're uncomfortable because of coping strategies. And you'll see it really quite frequently. If you apply a complementary therapy, be it acupuncture, be it myotherapy, be it massage, be it physio, the dog will just kind of go, oh, thanks. Yes, it was my neck. Yes, I know my knees look bad, but it was my neck that was bad today. Thank you so much. It now feels better. I can move. And I love that. And that's available to everybody. You need some help to start off with. So be you a cam follower or be you a street vet follower. If you're a street vet follower and your street vet team in that area have a physio, have a massage person on board, take advantage of it. Spend some time with them, learn about anatomy and coping strategies and the different tissues and what you can learn and you can apply yourself. So I regularly teach my owners how to massage the neck down into the shoulders into the thoracic girdle, down the back, and they are always surprised at what a difference it makes. If you're a CAM follower, please consider adding a complementary therapy to your protocol. You know, so you've got your weight loss and you've got your supplements, and you've changed your lifestyle and you're not throwing the ball anymore, you're regularly visiting your vets. What else? Well, look into the world of complementary therapy, physio, rehab, hydrotherapy, acupuncture, massage, myotherapy. They all have a place to play. And it would be a very long episode if we go into too much more detail, but don't forget them. What else do you want to kind of mention in our crossover cam street vet little chat?
Our crossover cam street vet little chat. Yeah, I'm not sure. I guess maybe, I mean, this is more a street vet point of view. We are also limited in the drugs that we can use on the street, but I don't know whether it be good for people to know about some other drugs that are available. I know you kind of touched on it a little bit, but
there's plenty more drugs there, and things are coming to market more and more. So we've got our whole family of non-steroidals, and then there's a new one out called Galliprant for those that are really worried about side effects. But we've got more things that are coming into the arena in the next few years, the monoclonal antibodies, that sort of thing. We've then got our next array. My next line generally is, as you say, paracetamol. Then you've got your more chronic pain meds. You've got your gabapentin, your pregabalins. Then you've got your NMDA receptor inhibitors, such as amantadine, memantine. And then you've got your tricyclic antidepressants, such as your amitriptyline. There is an array out there. The only thing that is absolutely imperative with using any intervention is it working? So something that I definitely want to say before we leave, there's two things that are really important to me. We will need to learn to be objective, because we can't promise you that one of those interventions is going to work. And that's the sad truth, is I can't give you a drug and go, I promise you this will take away all the pain forevermore. It might not touch the sides, but I need to know about it. So I need the owner to be able to say, my dog was doing this, this, and this before, which to me indicated he was uncomfortable. And since we started this drug therapy or this intervention, this, and this has changed for the best. So I know that that intervention is suitable. And if we all had that approach, I'm sure we'd have a lot better results, happier owners, happier dogs, less side effects. think we'd be more effective with our financial input. I know there's a lot of dogs out there that are giving meds and supplements, they're not touching the sides, or they don't need them anymore. So I think objective monitoring is something that's really important to me, and everybody can do that. There's many resources on the CAN page that I'll put in after this.
Yeah, cool.
I think another thing that's really important to me is I like dogs more than people now. So I'm very much the dog advocate. And by the time they show us pain, it's pretty bad. You know, they are incredible at coping. They shift their weight, they change their behavior, they change their routine. They are amazing animals, and we're so lucky to have them by our sides. So when somebody says to me, oh, it's okay, it's just a limp, he's not in pain, or no, he's okay, he's just stiff every now and then, I sit there going, oh my God, he's probably in agony. Please, can we take this seriously? I would love us to kind of empathize more. And I would love that word stiff to always make people go, I'm going to check whether this is pain before I assume it's mechanical dysfunction. So you are likely to appear stiff if you're mechanically not working very well, or you're guarding. And if you're guarding, then you're likely to be in pain. So let's lose that word stiff as if it's okay, and let's take it a bit more seriously. That's my kind of thing on that one.
So we've had a couple of questions. Can you see them? I don't know if we've got time to.
Yeah, so do you have any recommendations for objectively monitoring response to treatment and disease progression? Yes, there's loads. And what I can do is I can put some links later this evening on here of places that you can go to look. So classic ones are the Canine Brief Pain Inventory from the University of Pennsylvania. There's the Liverpool Osteoarthritis in Dogs. That's here from the UK, sponsored by Elanco. We have also got like the Cincinnati, the Helsinki, there's CSOMs, Coast, there's loads of them out there. And what I'll do is I'll put the link to one of the ones that I think is the easiest because we use it, and it's CSOMs. And the reason I like CSOMs, client-specific outcome measures, CSOMs, is because it means that you get to educate the owner as to why that clinical sign is there or why that behaviour change has taken place. So let's just run through what Holly's were. Holly would, on a painful day, have an arch to her back because her spinal nerves for her lumbosacral disease were hurting. So she was tucking her pelvis under to try and take the pressure, pinching those nerves. That was why she was arching her back. On a bad day, she would turn with the whites of her eyes rather than turning her neck because she had a painful neck. It was sore to move. She had cervical disc disease and she compensated her neck. On a bad day, her tail would be vertical and quite limp, and it wouldn't have much movement in it because she had lumbosacral disease. That was painful to move it. But when she was having a good day, her tail was like, yeah, hey, how are you? When she was having a bad day, her back legs would whisk like that, short little gaits, little steps. But on a good day, she'd stride. So for me, I could visually see whether she was doing well or doing badly, which gave me the ability to change her medication, adjust her protocol. If it wasn't improving, I could do some big changes. If we're having good times, I could reduce some of the medication. I like it also by giving people visuals, they remember to put the rug down. They remember to lift the dog out the car. We all have really busy lives. And you go, oh, just this time I'll let him jump out the car because I'm at Tesco's and I've got the kids are crying and, oh, one time won't hurt. If you can see it, then you don't let them do that. You're like, no, I know because I can see, I see. And it motivates you. And if you're giving the cocktail sausage to your overweight arthritic dog, if you can see that they're carrying discomfort, you go, no, put it back in the fridge. So I really like CSOMs because I think it doesn't actually leave the owner. It educates, it leaves them something to use daily. It motivates. So that I think is quite powerful.
Yeah, definitely.
Are you stroking a dog there?
Me? No, they're both. They're actually both outside. They're outside at the minute.
Okay.
So
cool. So we've done a fair whack of time. as I say, we wanted to get this in before Christmas. It's getting cold out there. I certainly wanted to help Jade and get StreetVet more well known over in the cam followers. So any cam followers that listen to this and you think, I want to donate a coat, so you can go to Amazon and you can go on the StreetVet wish list and you can donate, which would be a very amazing thing to do. And then I also wanted to be able to give StreetVet people, you know, some advice that you can take out with you. Oh, she's gone. She's gone. Maybe she will come back. But we're coming to an end anyway. So thank you very much for listening. And thank you very much for allowing Cam to come on your page. This will go and get posted on the Canine Arthritis Management page. And if you have any questions, then just please put them down there and we will do our best to answer them. So for now, lovely speaking to you. Speak to you again soon. Bye.